Well, hello, my friend Jessica. It is good to see you here today.
It's so good to see you, Dr. Quebeca. It's always my pleasure to come and hang out with you.
I love being with you. I love spending time with you. So I'm really, especially talking about pelvic health, and this is such an important topic. And what we're seeing right now are a lot of I would just say we're just seeing even more issues with pelvic health problems because of stress. We hold it in our body, and that create and certainly cortisol and more sedentary. If we're locked inside, we're in unnatural position called sitting a lot of the time. And well, I want you to go ahead and tell our audience about you. I'll just do a little shout out. Hello, everyone. This is Dr. Anna Quebec. I am your girlfriend doctor, the girlfriend doctor live here today with Jessica Drummond, who is a physical therapist, and not just that, a doctorate of physical therapy, and has led this, women's pelvic health movement, and really work with training physical therapists and people that are interested in helping women with their pelvic floor to rehabilitate, because there's so many issues from incontinence, pelvic pain, sexual dysfunction, painful cycles, pain with sex, all of these things. We say dysmenorrhea, dyspareunia, all of these issues just in prolapse, and that this affects the quality of our life, for our longevity, for our entire life. And there are many things that can be done. And many people don't even know that there's such a thing as pelvic floor physical therapists, or physical therapists that specialize in pelvic floor health. And I'm just thrilled to have you here with us to join.
Thank you. Yeah. So I started my career about 20 years ago now in orthopedics and sports medicine, and specialized pretty quickly in women's health. So if we think about women's health from a physical therapy standpoint, you think about, well, how would you apply looking at, musculoskeletal injuries like pelvic pain related to pregnancy, back pain related to pregnancy, incontinence and prolapse are really issues of kind of lack of the structural support of the vaginal wall, right? Lack of fascial stability from all that straining and pushing during pregnancy. And as a pelvic PT, I'm constantly carrying around a pelvis. So one thing you'll notice here, I'm trying to get the right thing.
Hold on, let me fix this. There we go.
Okay. So one thing you'll notice is that in the pelvis, you've got bones, joints. So this is your pubic bone right here, and there's a joint here. So we can spread this space to when someone's having a baby. But notice there's layers and layers of muscle here in the pelvic area. So Anna, you were mentioning that right now people are sitting for a long time, they're stressed. So this whole hammock of muscles that supports the base of the pelvis, just like if you're, walking around stressed with your shoulders up by your ears, you're going to have chronic headaches and jaw pain, things like that. It's the same idea with pelvic pain, that there are muscles and joints that can be very tense. And then additionally, so I had my own hormonal crash after the birth of my first daughter. That was back in 2003. And after that, I went to school and got a doctorate in clinical nutrition. So we also have to think of some of these chronic pain conditions, just like we think of, things like rheumatoid arthritis or other chronic joint pain related to autoimmune issues or inflammation in the body. Those kinds of immune factors, hormonal factors, neurologic factors in the brain can cause these painful conditions in the pelvis. It's not always just related to the muscles and joints.
Well, can you hold up that pelvis again, please?
Sure.
This is so important, because we also want to talk about something, especially with sitting, the psoas muscle. Can you show us where the psoas muscle would be in there?
Right. So the psoas muscle is attaching across the front of the body, right? So it attaches from really the spine in the back. So here's the spine, just the bottom of it, but it obviously goes all the way up to the neck. And so the psoas muscle attaches from the front of the spine and then crosses the hip. So if you're if your leg is constantly at this angle, your psoas muscle is going to be shorter. And we need to be able to stretch that to the full range of motion, lying on the stomach, standing fully upright without kind of a big tilt forward in the pelvis. A lot of this has to do with shortening of not just the psoas, which is a large kind of muscle crossing these joints, but fascia and other smaller muscles that cross some of the joints.
Yeah, no, thank you so much. And I think that's what's really, impressive when we're looking at the pelvic floor and looking at the muscles. And also just now with so much of a sedentary lifestyle being pushed upon us right now temporarily, that importance of stretching out and exercising the pelvic floor, it's really important. We talk also a lot about pelvic floor exercises or Kegel exercises, but there are times we shouldn't do it, right? There are certain conditions in which that can actually do more harm than good. So Jessica, can you talk about that a little bit?
Yeah, so especially with pelvic pain, which can be related to endometriosis, can be related to just myofascial muscle and fascial tightness in the area, can be related to things like vulvodynia or bladder pain, syndromes, pain with sex, pain with periods, that a lot of times we don't want to be strengthening the muscles. We don't want to be doing Kegels, because if you look at like my bicep here, we don't want to walk around. Like when you have these pain conditions, the muscles are often short. So imagine if I'd been walking around like this for, I don't know, the last 5 years of pain. And then all of a sudden someone's like, well, you just need to do bicep strengthening and then your pain in your arm is going to go away. Okay, sure. So now I'm trying to do more bicep curls. But what I have not done is extend and stretch and build strength through that whole range. And we want to think about the same thing for the pelvic floor. First, we need it to completely be able to relax and move, and then we can build strength into it. And a lot of times with pelvic pain related to even these, endometriosis, organ related pain, even pain from things like chronic constipation, there's a level, and another really common one is urinary incontinence. When people do have leaking, they're sort of half guarding all the time to try not to leak, but that tires that muscle and it has you walking around with it very short. Instead, we want to first focus on completely relaxation and really even doing some internal massage. So one of the things pelvic floor therapists do is they take a gloved finger internally and can reach these deep muscles that you see here and release. So massage, myofascial release, many techniques that kind of release the muscles internally. And then, so if you have pain, say, prior to sex or at the beginning of sex, if you have deep penetrative pain, often that's more related to endometriosis and some of the growths that can happen more deeply. If you have penetrative pain, or you just have pain like walking around, trying to use a tampon, sitting for too long, wearing tight pants, a lot of times we have to release those muscles before we can start to appropriately strengthen them.
And I think that's a really fabulous point. Now, Rachel, one of our Facebook friends, has written in. She's saying that she's 51 years old. She has 2 periods per month, super painful ovulation, and just feel blah all the time. And she says, I get really bad uterus pain a week before my period, where I'm on the floor sweating, nearly passing out, and having diarrhea. Sounds like a lot going on here. It does sound like, there's definitely maybe some endometriosis involved. What are your thoughts around this, Jessica?
Well, that's interesting, because at age 51, it's usually endometriosis presents much younger, but it's actually a myth that endometriosis is cured by menopause. Clearly, this woman is likely in the perimenopausal state given her age. And so if she's had this kind of pain, because that's really a descriptor of endometriosis kind of pain that happens more than just during the cycle. For some people, it's just during the cycle or right before. For other people, it's all month long. For some people, it's mid-cycle. For some people, it's all over the place. But the symptoms of endometriosis, unless someone has been on hormonal birth control, sometimes they're suppressed for a while, usually start in pre-puberty or early puberty, or at some point it becomes more noticeable in the 20s. But when you have such severe period pain and even ovulatory pain, endometriosis is certainly something I would consider. And it can lead to those sort of vasovagal symptoms, nausea, dizziness, because it's just such intense pain in the area. And it could also be related to pelvic floor issues, because if you can't relax the pelvic floor, then it's hard to have a bowel movement, or your bowel movements might be very painful, which again can trigger that dizziness, that sweating. So there's several ways I would approach this. There's lots of kind of levers we need to look at. One is, what is the pelvic floor doing? Two, is this something that she's had off and on through her life? Has she had other symptoms of endometriosis, such as struggling with infertility, for example? Has she ever had any kind of surgeries? Have other things that might be similar to this been rolled out, like ovarian cysts or fibroids? And from a biochemical kind of nutrition standpoint, we also want to look at, how stable is her blood sugar? How's her nutrient absorption? How balanced are her hormones, which is a combination of, the work that I've got in my book, but also your protocol as well. It's very similar in terms of balancing blood sugar and focusing on nutrient absorption to feed hormone regularity.
Yeah, no, I 100% agree. And that's my first thoughts in working with clients with either chronic pelvic pain, menstrual pain, uterine pain, peri or postmenopause. This is an inflammatory condition. We have to treat it, double guns in an anti-inflammatory way. So yeah, Keto-Green in my world. And you're going to share a link to your book, right? So I'm so excited about that. So be able to share a link to your book, and we'll put that in the chat box here, and that as a gift to everyone who is watching today. So that is huge, Jessica. I want to thank you, because I know you are meticulous at everything you do. And this is really a fabulous resource for women to have. But definitely going back to Rachel May and thinking about, okay, what else? We want the anti-inflammatory diet, hence Keto-Green, right? And look at food sensitivities. What else could be going on? Look at structure as an osteopathic physician, spinal manipulation, pelvic floor physical therapy. Let's loosen up anything that could be causing a constriction in blood flow or causing varicosities in the pelvic floor. And when we think of endometriosis, uterine fibroids, and ovarian cyst, we want to detox, hormonal detox. For us, it's again Keto-Green. I'd add in my detox support capsules, as well as enzymes. Enzymes help us break down micronutrients. The older we get, the harder that is, the less we absorb. So adding in the pure detox support, adding in the enzymes, and supporting your body too. And then I'm big on progesterone at this age for sure. Like I would add in cyclical progesterone and help with these symptoms as well. And be sure, Rachel, that you have visited your gynecologist, you have talked to your gynecologist, and you've gotten a pelvic ultrasound, because that has to be done. Just has to be done.
Yeah. And I think the other thing that's often overlooked is a lot of times women have maybe C-sections in their past or other abdominal pelvic surgeries. I used to work at a hospital where we delivered like 10,000 babies a year, which is roughly one every hour. And so C-section is the only surgery, and most women's abdominal surgeries are like this, where, if you're an athlete who gets a knee surgery, you immediately get rehab, right? If you have a major abdominal surgery, such as a C-section, that's it. Then you're sent home with a newborn. Like nobody does anything except tells you like, oh, your scar is healing. But often those scars are really sticky, and it can impact your gut motility. You might end up with, so you might be having diarrhea at some times of the month, but constipation at other times of the month. So if that's ebbing and flowing, we often use, supplementation for gut motility, things like ginger and artichoke, everything you said about enzymes and stomach acid support. So apple cider vinegar or betaine HCl, things like that.
Fermented vegetables.
Yeah, just chewing. We don't often chew a lot. We're eating really fast. But from a physical medicine standpoint, you can also work with a pelvic health physical therapist who has visceral mobilization training to work on the motility of the gut so that it's more consistent when you're eating. And you were talking about, we're all kind of stuck like at home sitting right now. Sitting posture, that kind of crunch of the abdomen, is not helpful for digestion. So just even taking a 15-minute walk after meals, getting up out of the chair every hour or two and doing some stretching makes a big difference to motility. I think we really underestimate the attention that we should be giving to allowing our bodies to digest.
I agree. And that intermittent fasting, extended fasting, gut health, oftentimes we're having pelvic issues, inflammatory issues. That 72-hour gut rest. We just finished our first round of Keto-Green 16 as a community, which was so much fun. Rachel's involved in our group, so I'm glad. The last 3 days, 14 to 16, you can do our Not Your Mama's cabbage soup. Awesome gut healing regimen, or a water fast. And either of those are really, really good, especially with inflammatory conditions, to see that. Rachel also wrote in that she has Hashimoto's and ovarian cyst. And to me, that's iodine insufficiency. We have to be so careful using iodine with Hashimoto's or with thyroid antibodies. I would look at levels, but iodine insufficiency, like seaweed, sushi, nori rolls, using that in your diet too, Rachel and others that are listening, that can be very, very, that can just be healing to our hormonal balance or system. And another thing too, vitamin D insufficiency. So vitamin D. So make sure you are at, 50 to 80 is where I like to see my clients nanograms per deciliter. And so to make sure that vitamin D is optimized too. So those things help. But gut rest, Jessica, don't you think, like just intermittent fasting and gut rest, it is so incredibly, it is speed healing.
Yes. And I think, in my practice for years, we've been using intermittent fasting. It's a really hot topic right now, but 12 hours of fast to start with is sort of normal. Like, people used to stop eating dinner at 7:30 and not eat again till the next day. But we have a bit of an epidemic. And I think, honestly, again, the quarantine situation that we're in, people's schedules getting messed up, staying up late, Netflix and chilling, which, hey, do what you need to do to get through. But if you're focused on supporting your healing, now is actually a really good time to do it, because we can be outside more. We're not commuting as much. Even if you just step outside and take a 15-minute after dinner walk and then be done with eating and then not eat until 7 a.m. the next day, that is really powerful medicine. It's actually been shown to prevent recurrence of breast cancer. And then if you take it a step further, as you've done in your book, a little bit longer fast, 16-hour fast for periods of time, you get immune system regeneration, which a lot of these pelvic pain conditions, endometriosis, vulvodynia, interstitial cystitis, which often occur together, have inflammatory components. But the research that we've published also shows that they have autoimmune components. So Rachel was mentioning that she has Hashimoto's, which is another autoimmune disease. Again, often autoimmune diseases play together, show up together. So if we use some of these immune regenerative strategies like nutrient absorption, so key when you were talking about iodine deficiency, vitamin D deficiency, magnesium deficiency is really common with tension in pelvic floor muscles. Protein absorption deficiencies are huge. So we don't have the amino acids that make the brain neurotransmitters that keep everything nice and calm. So between optimizing nutrient absorption and then resting the gut and restoring the immune system with a 12 to 16-hour fast each day, as you said, it really accelerates healing.
Yeah, no, it really, really does. So I think that's a perfect point. So tell us about your book and how people can work with you, or your pelvic floor therapist, and what to connect with you more. And by the way, I love watching your Instagrams.
Oh, I'm so Yes. Well, you can follow us on Instagram at Integrative Women's Health. And periodically I post pictures of random things that I cook and stuff like that.
Oh, speaking of which, how's Mark doing with Keto-Green 16?
He's doing okay. In fact, I'm thinking about joining him. He needs more like motivation, I think, with a group. So my neighbor and myself are gonna jump in for your next round and
Yay.
Just really enjoy it. I think this is one of those things that like anytime you've got a health goal and you've got a community of support, it makes such a difference. So yes, so we've actually, my daughter made the it's like keto pad thai that you had in there. So any of the recipes, which was delicious, and any of the recipes that we made have been really good. So we're now just enlisting the kids to do all the cooking because we're all home. So we're just going to give her the book and be like, okay, here's the meal plan. So
perfect. I know my kids have been cooking. I'm going to make some. We're in between, but I'm making some steak tonight, and I'm going to work on making a blueberry rhubarb cobbler, gluten-free, dairy-free, low-carb cobbler. I figured I'd add rhubarb. You've heard strawberry rhubarb, but anyway, it's a Southern thing, and I'm interested to check this out. All right, so at Integrative Women's Health, and your Facebook page is also at Integrative Women's Health.
Yeah, Integrative Women's Health Institute on Facebook and at Integrative Women's Health on Instagram. Okay. And I would love to give everyone in your community a copy of the book. It's called Outsmart Endometriosis. So anyone who's struggling with pelvic pain can really benefit from this. And as I said, it is a myth. Your gynecologist might have told you that you can't have endometriosis after 40, but that's really not true. We're seeing more and more people in their 40s don't really discover it until then because there's a lot more attention on it. And even now, on average, it takes 6 to 12 years to be diagnosed. So if you have symptoms like this, pelvic pain, sexual pain, take a look. Even if you don't officially get an endometriosis diagnosis, there are so many strategies you can use to reduce that pain. So the book is called Outsmart Endometriosis. You can get it at outsmartendo.com for free. And we have a team. We actually have an endometriosis program now where myself and a naturopathic physician, and we have a whole team of health coaches. We have a program that we have refined and tested for 8 years now. And we do a lot of work for people who either want to avoid surgery or who are having surgery and want to prepare for and recover from that surgery optimally. Because, women are athletes just like our guys that need knee surgery for football or baseball. Because as you know, Anna, most of us are juggling jobs and children and even more now than we've ever done. So we really have to pay attention to, if we're going to have surgery, we want to optimize those results and get back to function as easily as possible.
And two, the realization that, after childbirth, any one of us that have been listening and never had pelvic floor therapy or manipulative therapy and or acupuncture post childbirth, we've missed out, right? We have to do that. I think that's important. Yoga is great too, but really oftentimes just these concepts of rehabilitating the pelvic floor, and we do pelvic floor exercises till we die in a healthy way. But again, unless you have that strictures, right? Those strictures, as you talked about, then we want to strengthen and lengthen. And, in that way. Jessica, thank you for being here. It's always great to talk to you, my girlfriend. I'm telling you, I love it. And I hope to be connected soon. Are you traveling south anytime soon?
I don't know. We'll see. We don't really have any plans to leave anywhere right now, but hopefully that will change, in the next few months. So we'll see. And I just wanted to quickly say, yes, to your point, if you're closer to post-childbearing years, I've assessed a number of friends and colleagues in the last year who never had any pelvic PT after childbirth. And many of them had prolapses that no one pointed out. So if you've had a baby anytime in the last decade, just have an assessment with a pelvic floor PT to make sure you stay healthy, as you said, for all the way through your 80s, 90s, and beyond.
Yeah, because it doesn't stop. We rely on our pelvic floor. For continence and everything else. And with that note, just, that shout out, we've used this with a lot of your pelvic floor therapists have loved and recommended Julva with great results. So I had this sitting here on my counter. Do not ask why, but
I have some all over my house, so it's fine.
Right there. And so that's a big thing to definitely get. If you guys are listening and you haven't tried Julva, please do. And go to outsmartendo.com to get Jessica's very generous free resource of her book, Outsmart Endometriosis, and share that with people that you know and love. So for everyone listening, I want to thank you for being here today. Share this episode, pelvic health, pelvic anatomy. Did you ever get a lesson in pelvic anatomy in school? We need to understand our pelvic floor, pelvic anatomy, and how that affects us. And this is, again, what women are told, just power through. This is normal. It is not normal. And it's not normal to sit all day. I am feeling the strain. And I did 79, 80 now podcasts for book launch. And that's a lot of sitting because I can't be on my standing treadmill, my walking treadmill when I'm doing those podcasts. So it definitely, I feel when I'm doing those long stretches and walks, can feel the tension. So lengthening and strengthening is important for longevity. Jessica, thank you for being here with us.
Thanks so much for having me. Have a great day.
Bye, everyone. See you next time.